Google is here.
Please, tell me, what are you fighting for?
It's patient care. Woo! Kaiser, it's patient care. We're here because Kaiser needs to follow the law. There are regulations in the Department of Managed Care in the state of California that are very clear. There's no misunderstanding.
Well, but I need you to be specific because I understand that you have too many patients. The patients of Kaiser raised like 250,000 and the providers, the employees are less.
Right. Yes. So
explain that to me.
Right. So Kaiser's saying in the media that they've increased staffing by 25%, but they send the union every month how many workers they have, and we have statistics that show that they've increased staffing by 11, maybe 12% at the most, and they have increased their membership by 10 to 11%. So the difference is 1%.
Do you think that the reason is that Kaiser doesn't have the money to pay you?
You know what? Kaiser is a multi-billion-dollar corporation. They have plenty of reserves. As you can see, this medical center is a fortress, and it was built in a very short amount of time, and there's a moat around the fortress, and it's called profit. Yep. Wow. And it's a non-profit institution. The people of California should demand that a non-profit hospital provide the care that they sell to the public. This is a consumer rights issue. Because the folks that don't get the care, they drop out of the plan, they lose their job, they lose their families, and they end up on public assistance.
What about the patient that needs psychiatry help and has to wait 4 to 6 to 8 weeks? What happened with them?
You know, I have patients in my caseload, especially children, adolescents, and young adults who are not getting the care they need. I had a young man of color look at me straight in the face. He is a gifted athlete who's struggling in school, and he said to me, point blank, he sees no future. Wow. I just want to also say that Kaiser has said in the media that our behavioral sciences, we have no proven evidence-based interventions.
Proven evidence of what?
Interventions to help people get over emotional problems. They say that there's no evidence-based behavioral science that is like other fields of medicine. And I want to say to them that our great universities have, over the last 20 and 30 years, have shown over and over again that we have very reliable and valid methods to intervene to relieve the pain and suffering, emotional pain and suffering that our patients experience. These are chronic illnesses. There's no cure, but they can have interventions and treatments to have better quality of life. So
in a few words, what I understand, Kaiser is making much more money and the care is less and poor.
That's correct. The leadership, the current leadership of Kaiser is abandoning the original mission. We just spoke to members of the ILWU, the International Warehouse and Longshoremen's Union. They came to support our strike, the ILWU. 2 locals came to support our strike because they know that Kaiser started as a prepaid health plan for working people.
That's right.
It's all about working people, and Kaiser thinks that through the Thrive campaign, they could sell their product directly to the public, and they don't need these union contracts anymore. And that's very, very unfortunate, because what we basically are saying is that we have support from other unions, and they're upset with Kaiser too.
I understand that Kaiser has violated state regulations. Can you tell me about that?
I'm sorry?
Violated state regulations.
Not only do we have the federal parity laws that a Kaiser Permanente is supposed to follow, in the state of California, we have a Department of Managed Care that regulates HMOs. You know, in California, we've had a lot more experience with HMOs than other states, and other states are looking to California for a department that regulates. And they're very specific laws. Kaiser's breaking their laws.
Well, I need you to tell specifically what is
okay,
Kaiser?
It's about an appointment, the timely access. A patient calls up for an appointment that's non-urgent and they're supposed to be seen by their provider in a certain window, a time frame. I believe it's 10 days. So there's this window of time frame that Kaiser needs to see a patient, and they were fined $4 million because they violated the law. But we have evidence that they continue to violate the law.
Okay. I understand also that during negotiations, Kaiser is not supposed to make changes in your health insurance, things like that. What happened?
You know, Kaiser thinks that we're an impasse, and under labor law, union and management can, and an employer under impasse can make changes, but we haven't agreed to those. They think that because we're, quote, a small union, that we will not stand up for our rights and the rights of our patients.
So they, what I understand, they made changes without, when they were not allowed to do it during negotiations. That's what happened?
Technically, what I understand is that when an impasse is declared, the employer has the right to make these changes, but the union has the right not to agree to them.
Okay.
So no one has agreed to them. Unfortunately, our members, to basically weaken our membership, to divide our membership.
Mm-hmm. I have another question. I heard that the smart companies make their employees happy so the clients could be happy. Do you think Kaiser patients are happy?
Not like that.
Yeah. Let's talk about a smart company.
Yeah.
Smart companies understand that human capital needs investment. They need a certain benefit structure, a certain salary structure, and they need more than anything respect. And how do I define that? Is that they treat their employees like they want to be treated.
Does Kaiser do that?
No, it doesn't.
If you were today the president of Kaiser, what would you do?
If I was the president of Kaiser, I would first sign a contract for NUHW. But no, if I was the president of Kaiser, I would see that my historic mission is the winning philosophy. We have the opportunity to be a model for healthcare. We could even be the health plan that we would go to if we decide to have a single payer Medicare for all plan. Many people on social media say, I love Kaiser, why doesn't Kaiser be our health plan? But the president of Kaiser has not, they don't have an ethical principle to follow.
All right, I hear that do you think they walk the talk? So they present like a very caring company, and they really don't do that?
Yes. You know, Kaiser has, as in many companies, invested in brand advertising. Brand advertising is a way to create an illusion, a narrative. A narrative to deceive the public. And this is why our strong union, small as it is, but mighty as it is, because speaking truth to power will always win. So it's our union speaking up to Kaiser and saying that we know that you're not telling the truth, and what we want to do is organize our communities. We want the consumers of Kaiser and the communities that Kaiser represents to stand up. You know, Kaiser gives community benefit, but not commensurate with its profits. So we need to educate the public. That takes a lot of work, but ready for it. If our union, part of our union's mission is to organize the communities to help them understand what it means to be a healthcare consumer, we're on for it.
Anything else you want to add?
I just want to add something with my fellow executive board member. We stand here united, and you know, Dr. Martin Luther King's birthday is going to be Monday.
Oh.
And Dr. King gave us a quote that we have on our hearts that says, an injustice, would you like to say it? The worst kind of injustice is injustice in healthcare.
Okay. Thank you very much.
Thank you.
Everybody.